Okay, so in week 4, we are to reflect on different types of standardized tests that we learned in the chapter, and also touch on reliability and validity and the best suggested types of tests for young children. Um, Some of the tests that I read about in the infants are the APGAR scale, and this test is used in newborns, and it is a test that is given within the first 5 minutes of birth. The test is used to assess the heart rate, the respiratory effort, the muscle tone, the color, and the reflex irritability. The purpose of this test is used to locate any neurological dysfunctions. Another test is the Giselle developmental schedules, and were the first scales of infant development. This test detects infants that may have delays or require any special services. The Bayley scales are designed to learn about infant intelligence, and the adaptive behavior assesses the strengths and weaknesses in adaptive skills. Diagnostic tests are used in infants, and they are used to identify developmental or physical disorders. And a couple of things to note about diagnostic tests is that they are hard to get an accurate result. And also, observations that are done can lead to disagreements among observers. Denver 2 is a screening test that is used in infants, and it is used to screen for any developmental problems. Denver 2 is also used to screen in the preschool age level. And Denver 2, along with AGS early screening, require parents to fill out and be responsible for questionnaires. Some screening tests at the preschool level are also used to look for any cognitive, communicative, and motor issues or levels. Diagnostic tests at a preschool level evaluate adaptive behavior. And some tests that are used for that are Stanford Binet Intelligence and McCarthy Scale of Children's Abilities. Peabody Picture Vocabulary Test is one of the language tests that are used at the preschool level, and these tests are used to determine if a child should be a part of some sort of enrichment program. The text included several school-age tests, and some of them are the Wechsler Intelligence Scale, the Bender Visual Motor Gestalt test for children, and these tests are used to determine whether children need educational services, whether or not they have any disabilities. Diagnostic tests that are used among school-age children are the SPAC diagnostic reading skills, and they're used to pinpoint skills where students need extra help. Observations are also used with school-age children, and they are used to assess proper development. I took a look at the reliability and validity. Validity is the degree to which a test serves the purpose for which it will be used, and reliability is the extent to which a test is stable or consistent. So if you put this with some of the other tests, validity is just saying, what are we going to get out of this test? And the reliability is whether or not this test is giving us consistent and proper results. A few types of validity are content validity, and an example is a reading test and how well test items are measured and measure reading skills. Criterion-related validity is a validity of an aptitude test. Concurred validity is when current measures are used instead of future measures. Few types of reliability are alternative form reliability, and it is used when two equivalent forms of a final test are constructed. Split half reliability is when scores on a half of the test are correlated with scores from the other half of the test. Retest reliability is given to a norm group and then re-given a short time later. Some factors that can affect the validity and reliability of tests are the population size and the behaviors of students. When I connect all of this chapter to what I know, it really isn't a lot. I don't know a lot about standardized testing. I work in a preschool. I don't work in pre-K. I work with the 3-year-olds, so really a lot of what we do is just observations and documentations and not standardized testing. I think out of everything I read, the APGAR scale that's given to newborns is really the only one that I've ever heard of. When I extended, what new ideas did I get that pushed my thinking in a new direction would have to be that I always hear educators and parents, just a lot of people talk about how that there are too many tests, standardized tests being given to students these days, and I would have to agree with them. But when I take a look at these tests and I take a look at exactly what these tests in our chapter and what they're used for, they're really used in a deep way to help students, to make sure they're getting the appropriate levels of education based on the results that are administered from the tests and the screenings. So to me, I think a lot of the tests that are given are important. What I think is still challenging is, are most of these tests given to all students, or are they just given on an as needed basis? Also, are these tests given more than once throughout the year to see if the child has improved in any way from however way that the lessons have changed for them, whether or not they've been put in different reading groups or different classrooms or stuff like that.